is Reagan. I'm going to be your student physical therapist today. Is that okay with you?
Yeah.
Okay, so we're going to start off with some gross range of motion and strength test. And that's going to entail me putting my hands on you and you moving around. Is that okay?
Mm-hmm.
Okay, and I'm going to have to stabilize on your shoulder a little bit. Is that okay?
Mm-hmm.
All right, and you shouldn't feel any pain. If you do, just let me know.
Got it.
Okay, so the first thing I'm going to have you do is I'm going to ask you to bring this knee to your chest as high as you can, and then come back down. Great. You can brace yourself by putting your hands back. There we go. All right, so bring it up a little bit, and don't let me move you, okay? Okay, and then do the same with this knee. Great, bring it back up a little bit. Don't let me move. Okay, great. And then, so, go ahead and bring this up a little bit, and don't let me move you anymore, okay? All right, and now this one. Great. I'm gonna ask you to bring these out, bring your knees out, and then bring them back in. Great. I'm gonna get my hands in there, and don't let me push, okay? Great. Bring them back out, and hold. So now I'm going to ask you to bring your right heel to your left shin as far as you can. Okay, and don't let me move.
Patient was a 3 out of 5.
And go ahead and do the same with this one. Great. Now bring them out like this. Okay. All right, and bring it back out and hold. Great. Now I want you to kick your legs out and then bring them all the way back under. Awesome. And you can go ahead and back to normal. Okay. And do not let me move. Okay. All right, go ahead and kick this leg out and bend it just a little bit. Great. Same with this one. All right. Bend it just a little bit. All right, and hold. Good job. Okay, go ahead and bring your toes to the sky. Good. Hold. Hold. All right, down to the floor. And hold. Good. And bring your toes up to the sky, like inward and up. All right, and hold. Same with this one. Okay, and hold.
2 out of 5.
Now bring your pinkies out and up. Go. Hold. All right. Now I want you to curl your toes under. Don't let me move them. All right, same with this. Hold. Okay. Go ahead and extend them toes. Don't let me push down. All right, and keep them extended and don't let me bring them together. So now we're going to be testing some specific muscle strength, okay? It's going to be your knee flexion, your hip external rotators, and your foot inversion, okay? All right, so what we're going to do first is I'm going to ask you to bring your right shin, or right heel back up to your left shin. All right, and I'm going to ask you to hold it there.
Patient was 3 out of 5.
Bring your toe back up to the sky and in. Okay.
Patient is a 2 out of 5.
Okay, and then I'm going to ask you to lay on your stomach. And I'm going to bring your foot up in the air. And I'm going to ask you to just hold right there.
Patient is a 5 out of 5.
All right, good. All right, so this is a goniometer, and I'm going to use it to be taking measurements of your range of motion. And I'm just gonna have you do the motion, and then I'm gonna have to palpate landmarks on your body to perform the skill accurately. Is that okay?
Active range of motion of hip external rotation.
Bring your left heel to your right shin for me. Thank you. And then you can bring it back down. And I'm going to use the anterior aspect of your patella as a fulcrum. And for my proximal arm, it's going to be perpendicular to the floor, and my distal is going to be the anterior midline of your lower leg. All right. So I'm going to have you do that motion one more time. There we go. We're starting here. There we go. 0, 180. Perpendicular. And we get 35 for our active range of motion.
Now passive range of motion of hip internal
I'm going to have
rotation.
you bring that same heel outward. There we go. And then you can bring it back in. Same fulcrum, distal, and proximal arms. Starting at 180, 0. And then I'm going to have you do that motion again, well, passively now. Okay, and we're gonna see what we get this time. And we get 42. All right, that's passive. Okay, all right, so now we're gonna do inversion of the tarsal joints. And I'm gonna have you go ahead and point those toes up to the sky. In, and up. There we go. All right, and go back to resting. There you go, relax. So the fulcrum is going to be the anterior aspect between the malleoli. The proximal arm is going to be the anterior aspect midline of the lower leg up to the tibial tuberosity. And then the proximal arm is going to be midline of the second phalange. So we are palpating tibial tube, fulcrum, and this is in the middle. So we're starting out in 5 degrees of inversion already. Okay, and I'm gonna have you go ahead and do that same motion. There you go, active. And we get 26, so it's gonna be 5 to 26 degrees. All right, and we're gonna go back to these first. All right, so now I'm gonna have you go ahead and point that foot out laterally to pinky up. There we go, you can relax. Readjust our goni. Oh, my zombie fell off. All right, we're back to 5 degrees of inversion. And now I am going to passively take her foot into eversion.
You lost that one too?
And we are at 30. So it's going to be 5, 0, 30. Did you start? Okay. Now we're going to be doing a muscle link test. We're going to test your hamstrings. It's called a straight leg raise. Alright? So that is going to entail picking your leg up. And if you get it to 90 degrees, that is normal. Alright? So the fulcrum is going to be the greater trochanter, midline of the hip. The distal arm will be the midline of the pelvis, and the proximal arm will be the lateral side of the femur. Okay.
Are we gonna put it? Oh,
What?
You want us to tell you the
The distal. The distal side is the lateral femur. Proximal is the midline of the pelvis. I'm not redoing. And we're gonna check for the
femoral epicondyle just to make sure. There we go. All right, now I'm gonna go ahead and pick up that leg and see if we get to 90. Keep this leg straight.
Come back next year.
Do you feel a good stretch there?
Yep.
Yeah? That's about it? Yeah?
A good stretch.
Right there. So we're gonna put our measurements back on. Got it? And hold on. You can relax your leg. Oh, and we are at 90 degrees. Do you see that? Muscle length test, and this is gonna test for your semitendinosus and semimembranosus. And normal is 152 for women. As you can see, we have a woman. And so we're gonna flex the hip to 90 and then bring this up. And the fulcrum is gonna be the lateral epicondyle of the femur. The distal proximal is gonna be the middle of the leg, midline of the lateral femur, and the midline of the lower leg to the lateral malleolus. All right, so 90 here, and we got, wow, all right. Take that, put that there. Here. And we have
What? You're not, you didn't do editing like what I'm doing. I'm like cutting videos.
155 degrees. So she's normal.
Yeah.
Hi, I'm Shelby and I approve this message.